Hi everyone, it's me, Jennifer Sherman. I am almost 39 weeks pregnant. I'm like 38 and a half, whatever. I'll round up. Hopefully everybody out there is feeling well. I'm feeling fine today. This weekend I did take a trip to the hospital because I thought that I was having labor. I thought I was in labor. I didn't have contractions in the front. I had back contractions, but they weren't contractions. It was just back pain. And my mom only had back pain, and so I thought, better safe than sorry. I had had back pain for 24 hours straight, so I thought, you know what? I'll get the baby monitored. I'll get myself monitored just to make sure everything was okay. And clearly, I was not in labor. So, because my back was hurting, I wanted to show you guys a couple stretches that I really like. So some important stretches to do daily are hip rocking. So I'll demonstrate. You want to keep your knees under your hips and your arms, your wrists under your shoulders. You're going to concentrate on just moving the lower part of your back. Pelvic rocking, it's actually part of the Bradley method. It's a yoga move. It's really just self-explanatory. You just move, arch your back, and bend your back. As you see, it can release your muscles in your lower back. And my chiropractor said your ligaments and your tendons just really stretch out when you're pregnant naturally. That's exactly what they're supposed to do. So when you stretch, you have to be careful that you don't overstretch. But pelvic rocking will actually help put the baby into the correct alignment for delivery. It can help release your sciatic nerve. And it actually helps with digestion. So if you're having any trouble with that, this might help. So it's smart to do this every day just for a little bit to help release your back. From here, let's go ahead and move into downward dog. If you got a big belly like I do right now, you want your feet wide, okay? You want it wider than your belly so that you have room to really extend your back. Good. And if you're not in your third trimester yet, and your belly is still quite small, or like it used to be, you can keep your feet closer together. Really, just do what you need to do. Sometimes you might feel like you need to move side to side. That's up to you. Go with your feeling when it comes to stretching. Slowly walk yourself forward. Again, since I'm 39 weeks, well, 38 and a half, my feet are going to stay wide, okay? I can't bend over with my feet together because my belly will be uncomfortable. I don't want that. My hands are going to be in front of my feet, probably like 2 feet in front, so that my back can be either straight or I can try and bend my elbows and reach down. Again, in this position, you might want to bend one knee and then the other. That's up to you. Good. From here, we're going to turn our toes out wide, coming to a squat, a frog, whatever you want to call it. Again, this helps stretch your pelvis muscles, your pelvic area, and it helps bring the baby down with gravity. So shortens your birth canal, which I've said before, so I won't repeat it. But you can just hold it here. The later you are in pregnancy, again, the looser your ligaments are. So you really have to be careful. If this puts too much of a strain on you, stop. Don't do it. You can sit on a block. You can lean back in a chair. You can just sit on the floor and keep your knees up towards your armpits. So that's up to you. Couple deep breaths. Right now, just focus on visualizing yourself in labor. We know it's tough. We know it's supposed to hurt. But focus on breathing. Visualize that baby coming through the birth canal with no problem. You know, we don't know the unexpected when it comes to birth, and every labor is different, but visualize yourself in that positive manner. Picture the baby coming through the birth canal, and you're taking deep breaths. With the pain, it means the baby is coming closer and closer. From here, move into Baddha Konasana, yoga move, or butterfly pose, whatever you like to call it. Feet together, push your feet together. So activate those feet, push the heels together, sit up nice and tall. If you want to, reach your hands forward. If you're not in your third trimester and you still can go all the way down, then be my guest. Go all the way down again. It's your stretch. Do what you feel is comfortable. Good. Come back up. My favorite stretches, I'm just going to cross my feet, put them into easy pose. It's just reaching over, so I'll put my right hand down, my left arm up, and I'll just stretch over to my right and look up by my hands. You want to really lengthen through your spine to give your baby more room in his or her little womb. Deep breaths. One more inhale. And exhale, switch sides over to your left. Reach it up. Look up towards your arm if that's comfortable. If not, you can look straight ahead or down at the floor. It's up to you. The deeper the breath, the more oxygen you get into your body. The more oxygen we get into our body, the more oxygen our baby will have. Keep that in mind. As new mothers, or as mothers, our life is not selfish anymore. We can't be selfish. We have a life to raise and to take care of. So really calm yourself down. Think of as many things that you can do while you're pregnant to stay healthy, so that your baby has a better chance of being healthy, okay? We can be selfish during our pregnancy, but we know that once that baby comes, our life is consumed with a new life, which is a beautiful thing, but it can be overwhelming. So keep yourself calm. The more you stretch and do yoga, the better you're going to feel. We're just going to do some gentle twists. Take that right arm, put it behind you, left arm on your right knee, and just look over your shoulder. You want to keep your belly button facing forward, so your baby is facing forward. If this hurts, you can loosen up a little bit, or you don't have to do it at all. It's up to you. One more breath. Exhale and switch sides. Over to the left. Look over that shoulder. Deep breaths. One more breath. Good. Well, I hope everybody is feeling well. Hopefully your back doesn't hurt like mine did this weekend. And if it does, these stretches should help. So try and do it a few times. If you have any questions at all, feel free to send me a message on YouTube or Facebook me. It's up to you, but I would love to help out. I've still been having my smoothies every day. I talked about those in earlier videos, and I think that actually helps with cravings, because when you have cravings, it means your body is lacking certain nutrients and vitamins, unless you're craving straight up sugar because you've eaten too many cookies or ice cream, whatever it may be. But a lot of times, if you're